all, I'll thank the organizers of JPF for giving us the opportunity to chair this important session on insulin workshop. We have the first session, the Inject Like a Pro, Mastering Insulin Injection Techniques. The speaker is Shuji Juk. Shuji Juk is a diabetic educator specialist known as India Private Limited, living with type 1 diabetes since last 34 years. Proficient diabetes educator and counselor for people with diabetes considering age, gender, psychosocial education background last 18 years. Played a key role in diabetes education and care of children enrolled in changing diabetes. Prepared many innovative diabetic education materials. The CDIC project, everything is here. Trained nurses and educators, conducted more than 50 trainer camps, conducted nurses, dietitians, pharmacists, and been a speaker for many scientific conferences, including RSSDI, Diabeticon, ISPAD 2018, Workshop Diacon 2018, and many articles in various aspects in diabetes. For laypersons, scientific articles, and have authored chapters in diabetes educated book and one chapter in CDC textbook on diabetic. And now the floor is yours, madam.
Thank you so much, sir. First of all, I'd like to say I have left no one on this, but rest of all this is correct. Okay, and like it's not important, but it's important to tell that the fact, nothing else. So, injecting insulin. Whenever a person with type 1 diabetes or type 2 diabetes, type 1 diabetes, a person requires insulin from the day one. In type 2, whenever they require insulin, they are said that you will be requiring insulin. Generally, the things come into the person's mind is, oh, what to do, how I can inject, how the things are going to work. It's very difficult because if we understand why it comes into the mind of the person is because we have been always told that giving an injection is a professional's job. And when we think or talk about taking insulin, it comes like a punishment. Now, we need to understand that insulin is lifeline for children with type 1 diabetes. Insulin is essential for many people with type 2 diabetes. So, when a doctor suggests insulin, it is required that one must take it. The fact is that improper use of insulin device or injection device can lead to undesirable consequences, but the fact also remains that when a person takes insulin properly, it gives them life. I always suggest all my patients that whenever you take insulin, especially type 1, you need to say thank you. I don't call them patients also, or people, children, I call them children because it gives them life. Now, whenever we talk of insulin therapy, it needs to be individualized. We all know there are multiple factors. Finances, lifestyle, inhibitions, many things are there. So, it has to mimic the physiological profile as physicians or educators we know, but it also needs to understand, we need to understand the psychosocial constraints of the person. But when it is essential, we as healthcare professionals need to work on their psychosocial profile. Matching of insulin needs to be done with IU40 and IU100 syringes. I hope they are here only. IU40 is red capped and IU100 is orange capped. Insulin needs proper storage and compliance with the treatment is the key. If we go as we move, there are many people who don't comply. If you are going for a party, we leave insulin at home. If we are going for a traveling, we leave insulin at home. Insulin, or like what I always say, if you are a person with type 2 diabetes and you are prescribed lifestyle management, they are for forever. If you are prescribed medicines and insulin, I will not say they are forever, but for people with type 1 diabetes, insulin is forever. You can't keep it at home and keep the glucometer at home and go to a party. In fact, you need it more when you go. So you need to understand. So you need to keep the insulin management along you. So you need to understand the syringes. IU40 and IU40. We get a call at mid of the night or sometimes in the evening, like late night. I have forgotten my pen. So can I take my needle is broken. Can I take with the cartridge with IU40? No, you can take it, but with IU100 syringe. So you need to match the insulin with the syringe strength, and that is very much essential. We all know insulin is a subcutaneous injection, so we need to tell when we teach patients, because they need to take it. It is easy and they can take it themselves. While teaching from last 20 years, I have come to one point. If we teach someone else, for example, if there's an old lady, I teach her daughter, son, daughter-in-law, son-in-law insulin, the chances that they will miss the insulin are 100%. If we teach people themselves, they will never miss. So it's always good to teach them. Teach them which insulin needs to be taken at what time. Regular insulin needs to be taken 30 minutes before meal, and mixture of regular insulin if required, that also 30 minutes. Rapid acting insulin 5 to 10 minutes, no more than 15 minutes. Basal insulin anytime, but even in that there is a criteria. For example, if you are pre-meal sugars, we were having a monitoring session, if your pre-meal sugars are already high, then if you take 30 minutes before, but as you will learn only when you know about diabetes. A person with diabetes, the Jocelyn statement, who knows more, lives more, is the true statement. So there are many kinds of insulin devices. We have come from glass syringes which needs to be boiled to syringes with like plastic, which were earlier known as only from BD, but now there are many companies, to insulin pens. We have pens from all the companies. You can see one. And there are two categories: pre-filled pens and reusable pens. Pre-filled pens have all the things, insulin cartridge in one device, that like you don't need to change. But in reusable, although a person needs to change, but the best part is they're economical. They give the strength up to the person to use the pen, because you know, if you are carrying, as I was telling, if you have to go to a party and you can't miss insulin, pen is the device you can carry easily. Now coming to the core of the subject, that is insulin injection technique. Many people say insulin pains. I always tell them two things. It pains. First, if you think that insulin is your enemy. Second, if you don't do it properly. First, think it is a friend, because one who gives life is always considered to be as a friend or someone very close. So when you say thank you insulin, it will not pain, and if you give it right, it will not pain. So it has to be given in the subcutaneous tissue. You can see the slides. And nowadays we have needles that are very small, so you don't need to even give it an angle. So even needles from the syringes are now shorter. They can be given at 90 degree. If the fat is very less, then between 45 to 90 degree, but mostly we can give it at 90 degree itself. The correct way of is to give a small pinch, don't give a big pinch. In fact, at a practical level, you don't need to even clean the surface with alcohol swab, which is usually said. But if you want to, if you are outside, you can clean it, let it be dry, and then give insulin. And if you are taking with bottle, then wipe off the outer coverage with the swab, but let it be dry before the insulin touch. I think we all know, because the needles are silicone coated. It is very essential that in pre-mixed insulin, when there is cloudy, it needs to be rolled. So, although we have shown that white skin with alcohol swab, if you take a daily bath, if you are taking bath at morning and you are a clean thing, you need not. Or you can even clean with cotton dipped in warm water or hot water, because alcohol swab removes the silicone coating. So in pre-filled pen, when we talk about pens, as I said, that they give the convenience to carry it all around. You can just need to twist it, should not be kept on the pen. Preferably, you can keep it out and keep it in the box and then again put it. Or you have to prime it, because if the air bubble comes, especially in younger children, then what happens, you can inject air bubble and you will think that the sugars are not coming down. So that is the process which needs to be avoided. So I think pre-filled pens, it's very easy. You just dial, see the dial nose, take it and see the zero has come. It is very essential that zero has come should be noticed, because if it is not zero, that means either the needle is blocked or something is that, so that the injection is not there. And reusable pen, what I have seen in few months, twice it happened when the person is on travel, because it's traveling, we have this what we call as air pressure induction that thing, and the cartridge, there was a gap. So when the person was dialing, nothing was coming in. Then we could see the gap between the end of the cartridge and the induction, and that the gap needs to be filled, because it automatically went down because of air pressure. So it's very essential that whatever you use, you must know how to use it, and in one case, please carry IU100 syringe with you if you are a pen user, because pen device can go wrong, and when pen device go wrong, then IU100 syringe in your bag will be acting as savior. You can take insulin from them and you will not miss it. So it's very essential and practical tip that carry IU100 syringe. And in fact, I always ask even pump users to keep IU100 syringe, because in pumps and pens we use IU100 cartridge, and we always say that we need to match. And as we say, temperature and pressure changes I have discussed may cause air bubbles to form if cartridges when cold, and insulin to leak when it's hot. Hot is always important, especially when we talk about Delhi, Chennai, Trivandrum, when the temperatures are going above 30. So although we know that we are carrying it in our bags, but sun rays or hot temperature can destroy your insulin. So carry it in a cool pouch, remove the needle and keep it side. For premix insulin, the drainage is more, and this can also lead to the incorrectness of ratio. So it is always important to keep it safe, roll it before injecting. Now, a very important thing is rotation of injection sites. We all know that injection sites needs to be rotated. We know that it's on the arms, it's on the abdomen, it's on the thighs. One practical advice to all the educators, nurses, that whenever you start giving the first injection, don't keep it at one side. Because what I have seen, the first injection trauma always remain with the patient. So there was a child whom I met, the first injection was given only on the abdomen, and he was not ready to take it on the abdomen for at least 3 years. It took me 3 years slowly counseling. So you can give it one on the arm, second on the abdomen, third on the thigh, one on the buttock. This will give first the person understanding that it can be taken at all places. Then while discharging, you tell the most of the morning and afternoon injections in the abdomen and give the rotation grid. If you don't have this rotation grid, it's very easy. Take a paper, put it on the arm of the child or put it on the place, put holes. It's very easy. You don't need any rotation grid if you don't have, but show it on the piece of paper by making holes. And while working with children, I have seen that this process of making holes is the first step for which I involved a 3 year to give first step towards self-injection. 3-year-old will not do it but can make holes. So when the child is 4 or 5 years old, then they start understanding that this is the way I can take. So this is the involvement we need to make it. So rotate it, check it, anyway, even if you are ask the person to take the palm and check the thing. If they say that it's nothing but some lumpiness is there, that means that lipohypertrophy is there, and they need to leave that place for at least 15-20 minutes. every time you need to check that because it causes quick absorption, less absorption, intramuscular injections and all the drama. Again, you need to know that the speed of absorption in thighs is slowest, arm is medium, abdomen is fastest and buttocks is slowest. So for arms, it is always required that another person gives rather than you give it to you. For your self-injection, abdomen and thigh are the best. But morning and afternoon, abdomen and thigh in the night, because if you take an injection in the thigh and do some kind of running, it may be running for a bus, it may be a cricket match, the absorption can be quicker. That means one day it can cause hypo and another day it can cause hyper. So again, one thing to remember, that injection site needs to be rotated, 2 finger width needs to be there, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So 2 fingers of the individual for whom the injection needs to be taken. So choose one pattern, finish that, let it heal, choose another pattern. Again, arm is only if someone is giving. It is better to give in abdomen and thigh. Abdomen in morning and afternoon because it's very stable pattern. Abdomen will be affected only then if you are doing some stomach exercises, whereas legs can be affected at anything. Again, we have talked about lipohypertrophy and lipoatrophy. Incorrect techniques can cause problems. Needle reuse, again, not more than 4 or 5 times. First, if you have any illness, any injury, please don't reuse. But India is out of pocket, so people will reuse. Don't let people use the same needles for the whole pen, that is wrong. So depending upon the person, we have talked about storage, it has to be between 2 to 8 degrees Celsius. And if the patients don't have a fridge, then matka buried in mud or covered with wet cloth. Winters, it can be kept in cool place away from direct sunlight, and while traveling, carrying in cool pouch and not in luggage. It is also important that needles should be disposed properly because people who come for cleaning the things are also humans. Inject with love and confidence, do not use alcohol swabs. In fact, I have used all these things while telling about injection, like while my presentation. In nutshell, while teaching how to take insulin, teach carefully. As a team, speak the same wordings. Individual, family are a part of team. Teach them with self-dependence. As I said, they need to be taught rather than someone else. It's a complex disorder. Lifestyle changes are needed. Intensive education is needed. Patient empathy, knowledge, and love all are important. Thank you so much. And I think your few words of love can change your patient's attitude towards insulin. Thank you.